From consumer advocates
We need better staffing.
to industry professionals
We too agree that staffing is the greatest proxy for quality of care.
to lawmakers,
When you have so many patients to care for and you don't have standards, you don't have human care.
it's widely agreed upon that higher nursing home staffing levels lead to better outcomes for residents. And yet, Virginia has remained in the shrinking minority of states without a minimum staffing standard in place. Tracy Pompey, whose father died in a nursing home that was cited for delaying his care, feels lawmakers have slow-walked what should have been a critical priority.
It angers me that, this has been happening for too long. This has been happening for decades, and you still can't do anything?
But that changed in 2023 when the General Assembly passed a state-level staffing requirement, which was endorsed by provider organizations like Leading Age Virginia, where Dana Parsons is vice president.
We supported that legislation and we worked with the patrons of the legislation. And as soon as it dropped, we started informing our members about it.
The law requires facilities to provide at least 3.08 nurse staff hours per resident per day. Now, that was a disappointment to advocates who pushed for a higher standard, but considered fair by industry lobbyists who say the workforce was hindered by the pandemic. Democratic delegate Vivian Watts, who has introduced other staffing bills for 2 decades, says the law that passed allows facilities to remain out of compliance for multiple years before ever facing consequences like fines or action on their license.
I objected again and again to the lack of serious enforcement, where you could go on year after year after year, again and again. The word may rather than shall was throughout the legislation. It was very, very open-ended, and it did not contain the level of oversight that we need to have.
The legislation also came with a delayed implementation date of July 1st, 2025. So this month, the standard was expected to be in place. But it remains in limbo because the regulations have still not been finalized and, in fact, are in the early stages of the regulatory process 2 years after the Virginia Department of Health initiated action.
So it's been quite a confusing picture going forward.
Governor Glenn Youngkin's office says that's because of restrictions on the law that the industry advocated for. A clause stated that in the event of a federal staffing requirement, the state standard would be void. Now, there was a federal rule finalized last year, but it has been legally challenged and delayed by 10 years through the adoption of the One Big Beautiful Bill. So that should allow for the regulatory process to continue, but it is behind schedule.
Very disappointing because, like I said, you've been waiting for this. I'm sure residents in nursing facilities, I'm sure our elderly in nursing facilities have been waiting for this, and then to get shot down again.
Regardless, Youngkin's spokesperson says nursing homes should move to the higher standard of care voluntarily without waiting for state enforcement.
As not-for-profit providers, they are mission-driven, and quality of care is paramount along with staffing. So I would say that our members at this time are not really confused about it not going into effect on July 1st because they were already implementing it.
I'm Tyler Lane for CBS 6 News.